More than half of elderly care places in parts of England are in failing care homes, an investigation has found. In 6 areas, more than 50% of the beds available are in homes rated as inadequate or needing improvement. In 45 local authority areas, a third of the total, at least 1 in 3 beds is in a poor quality care home. In 6 areas across England, more than 50% of the beds available are in elderly care homes rated as inadequate or needing improvement. File photo. The problem is particularly acute in central London, Greater Manchester and West Yorkshire. It is worst in the London Borough of Westminster, where 69% of beds are in substandard homes. The analysis, by the Consumer Group, which highlights the postcode lottery in the provision of quality local care across the country. The campaign group warned that the situation could worsen as demand starts to outstrip supply in an increasing number of local areas. Earlier which research found that almost 9 in 10 council areas across England predicted a shortfall in care home places by 2022. The survey, described as disturbing by which, underlines the extent of the crisis facing England's broken care system. Despite the huge care costs that relatives are forced to pay out, often forcing them to sell the family home, many receive substandard care. The Mail told this year how the Care Quality Commission watchdog intervened over poor standards in care firms 4 times a day, up by almost 70% in a year. People who go into a care home have to use their assets, including the value of their home, to pay the full costs of their care until they are down to their last £23,500. 2 years ago David Cameron pledged to bring in a £75,000 cap on total care costs, but this has now been shelved until after 2020. In 45 local authority areas, a third of the total, at least 1 in 3 beds is in a poor quality care home. File photo. Ministers are under pressure to provide extra money to save the care system from collapse, but there was none in last week's budget. Alex Heyman, from Which, said, having to choose a poor care home isn't really making a choice at all. It's disturbing to know that so many people across the country are already in care homes that are clearly not good enough. Caroline Abrahams, from Age UK, said, it is completely unacceptable that many older people with significant health and care needs have no real choice but to live in poor or inadequate care homes because that's all that's available in their area. Older people and their families who find themselves in this position are entitled to feel outraged and very badly let down. What's worse, we fear this situation is more likely to get worse than better because the funding gap facing social care is already big and projected to keep on growing. Which came up with the figures by looking at Care Quality Commission data. In only a small number of areas are at least 9 in 10 care home beds in homes rated as good or outstanding. These include the Isles of Scilly, 100%, Richmond upon Thames, 94%, Rutland, 91%, and Blackburn with Dewey, 90%.